We're talking with Dr. Robert Abel Jr. He's an eye care specialist, and we're talking about lutein, the benefits of lutein for eye health. How much lutein should we be ingesting, Dr. Abel?
Well, when they do blood studies on lutein, they find most people are deficient and only get 1 to 2 milligrams a day and have a very low blood level. You need 6 milligrams of lutein a day to maintain your level in your retina. And since we have so much studies about retina and macular studies, we have a good idea of what's important. So the amount is important. If people have a tendency and a high risk for macular degeneration and other retinal diseases, they should be at 10 milligrams and perhaps even more for short periods of time. But there are also different kinds of lutein.
That's what I was going to ask you.
If you look at what the availability is in nature, it's the free lutein. So when people are thinking lutein, they should think the free lutein. There are other kinds of conjugated luteins, like lutein esters, but that's not as readily available and digestible. Therefore, when you take a lutein ester, it has to go through different phases to be well absorbed in the gut. So all of the studies we talked about with macular degeneration and protection and health of the eye have been done with Fluoroglow lutein, which is the classic one that's been studied because it's free lutein and much like what is used in nature, what's found in nature.
Free lutein, you mean? Free lutein, you say it's found in nature. You're talking about your plants and egg yolk and corn, and that's what's in Fluoroglow.
That's what's in Fluoroglow. It is the readily available, readily digestible, and readily usable at the cell level. Because if you were to take a piece of tissue and look at what's in the tissue, you won't find any esterified lutein. You'll only find free lutein. So you might as well go to the source, use the source, and that's what's most adaptable.
Okay, thank you, Dr. Abel.
You're welcome.